Most American adults are not meeting physical activity guidelines. The impact of meeting physical activity guidelines on U.S. adults and how we can improve outcomes. What are the physical activity guidelines and why are they important? The Centers for Disease Control and Prevention, CDC, has released physical activity guidelines to help people stay physically active and healthy. These guidelines provide recommendations for aerobic physical activity and muscle strengthening activities, as well as other types of physical activity that can be beneficial. By following these recommended guidelines, individuals can reduce their risk of developing chronic diseases, improve their overall health, and maintain a healthy weight. This video will discuss the importance of adhering to the CDC's physical activity guidelines and how it can help improve one's health. Analyzing the prevalence of meeting physical activity guidelines among U.S. adults. According to the latest report by the Centers for Disease Control and Prevention, CDC, on physical activity among U.S. adults, only 1 in 3 adults meet the recommended guidelines for aerobic and muscle strengthening activities. This is a cause of concern as it indicates low levels of physical activity among adults in the United States. This video will analyze the prevalence of meeting physical activity guidelines among U.S. adults, along with examining trends in physical activity over time. It will also discuss how meeting these guidelines can help improve overall health and well-being. By understanding this information, we can better understand our current state of health and make informed decisions about how to improve it. The benefits of meeting physical activity guidelines for improved health and well-being. Regular physical activity is essential for good health and well-being. Meeting the physical activity guidelines set by the World Health Organization, WHO, can provide many health benefits, including improved physical and mental health outcomes. Exercise can help to reduce stress, improve mood, increase energy levels, and promote a better quality of sleep. It can also help to reduce the risk of developing chronic diseases such as heart disease and diabetes. In this video, we will discuss the benefits of meeting physical activity guidelines for improved health and well-being. We will look at how regular exercise can improve both physical and mental health outcomes, as well as how it can help to reduce the risk of developing chronic diseases. How to increase adherence to the CDC recommendations for U.S. adults. The Centers for Disease Control and Prevention, CDC, recommends that U.S. adults engage in at least 150 minutes of physical activity each week. However, many people are not adhering to these recommendations. Therefore, it is important to understand the strategies that can be implemented to increase adherence to the CDC's physical activity guidelines for U.S. adults. In this video, we will discuss various strategies such as providing incentives, creating an environment conducive to physical activity, and utilizing technology-based solutions that can help increase adherence to the CDC's physical activity guidelines. CDC recommendations to improve physical activity. Provide access to safe places to play and walk. Social supports and community groups. Signs encouraging physical activity. Provide parks and recreation centers. Community events that encourage physical activity. Physical activity helps to prevent and manage cardiovascular disease, cancer, and diabetes. Physical activity improves thinking and learning. At the same time, it reduces depression and anxiety. Physical activity improves overall health and well-being. Our society is becoming more sedentary. We have to become more physically active. Go outside and enjoy your local parks. Plan physical activities with friends. Every little bit of activity adds up to a healthier you. We hope that you've enjoyed the video. Please like and subscribe to our channel. Thanks for watching.